Okay, right now I'm here with Mr. Sivaprasad, and he is the founder and CEO of MCS Medical Tourism. Now they are here all the way from India, and you might wonder what medical tourism is. So, why don't you tell us what is
Yes.
medical tourism?
Yes. Hi, Delaney. Good evening. Uh, Medical tourism is a phenomena where people travel to another country for medical treatments. So this is happening basically because of various reasons. The first thing is about the technology. Sometimes the advanced treatments are not available in their country, so they go abroad for their particular treatments. Let's talk about PET CT scan. That is a common diagnostic test what we do to detect the cancer. So that treatment is costing around, let's say, 100,000 LKR in India, whereas it might be costing double or thrice of the price compared to Kerala here. So people come there for treatment. So similarly, they go for treatment. The cost advantage, and there will be some kind of the expertise. Sometimes the expertise of doctor is also matter a lot, because um, ultimately they are the people who are treating the diseases. So people go for this kind of expertise as well. But compared to Sri Lanka, what best we can offer is in terms of technology. You know about India, we are one of the populated country, and it's a huge market.
Very true.
So because of that, we were able to have better technology in place, better doctors in place, and some advanced surgeries are happening on a regular basis there.
Okay.
It's not that it's not happening in Sri Lanka, but comparatively the volume is less here. But because of having a huge volume, the expertise of doctor is also increasing a lot there.
Apart from being cost effective and also doing more advanced medical procedures, are there any other advantages?
Yes, it's improve our quality of life. It improves the total treatment. It's not only the cost, but our health benefit is also there. So sometimes when you are doing a surgery, the kind of infection what you get in a normal operation theater, it will not happen in a very complicated operation theater. So those kind of technological advancement is giving ultimately benefit to the patient, that they need to suffer very less compared to uh, other countries. So that is their major advantage. And of course, there are cost benefit as well, but the most important thing is their health, no?
Very true. So tell me a little bit about how Kerala emerged as a place very famous for medical tourism.
So that's a nice question, Delaney. Actually, Kerala is historically known for its healthcare benefits. I mean, healthcare parameters. We have some of the uh, best treatment modalities available in India. We have both traditional medicines as well as the modern medicine available in our country, I mean, in our state. And as you know, most of the places, if you go anywhere in the world, you will find a Malayali doctor who or a nurse working there. So we have a very good number of doctors and number of trained clinical staffs available with us. So that is one advantage what we have in terms of people, and we also have better technology available with us, because as I mentioned earlier, India is a huge market. So there are a lot of people who are looking for treatment in Kerala from across the world. So we have good number of people coming to Kerala for treatment. So we can have good technology also in place. And if you compare the cost with Chennai or Bangalore or other places, we are way cheaper, and we also have a better ecosystem. Not only just the treatment, but the cultural and other aspects as well. So we are so welcoming people. So, and traditionally, Sri Lanka and Kerala, more or less look similar. So there's a cultural connect as well. So that is the reason a lot of Sri Lankans are coming to Kerala for treatment.
I was about to ask you whether cultural and geographical factors do affect Kerala being one of the most famous medical tourism facilities, rather, where Sri Lankan people can go there. So you have.
Yes, of course, it plays a vital role because the air connectivity and the travel facilities, it matters a lot. Kerala have 4 international airports within that small state. Kerala is a very small state, like it's a coastal state like Sri Lanka, but we have 4 international airports. So there is a good flight connectivity, and the road and other infrastructure is also very good, so people can easily access. That is another advantage what we have.
As the founder and CEO of MCS, can you tell us what are the services that you provide, especially for a Sri Lankan patient?
Okay. We are providing 360-degree services for the patients. Like, for example, if a patient want to do a surgery or any procedure, if they have recommended by a doctor, they can send us the medical reports. We will, based on their specialty or the requirement, we will discuss with a particular hospital or a particular doctor, and we will provide them with the complete plan. How many days they need to be in India for treatment, how much amount they need to spend there, and what kind of treatment they are going to get. And its complete picture is given to them. And we will also facilitate, if required, we will facilitate teleconsultation and doctor to doctor interaction. So everything is set before they come to Kerala. Okay. And after they decided to come to Kerala, we will also help them in obtaining the visa, because they have to come in a medical visa. So the visa invitation letter is required from the hospital. So we facilitate that. And once they land at the airport, we receive them and we take care of their logistic arrangements with their travel and hotel accommodation and everything. And we will also book their appointments with the hospitals. Once they completed their treatment, we will arrange them for the post-treatment stay as well. So overall, from they think of a treatment from, and once they complete the treatment, to follow consultations as well, we will facilitate everything.
If there is a Sri Lankan watching right now and wants to go to Kerala to get a medical procedure done, what are the things that they should bring with them? Because I'm sure they are wondering, what should I bring? What should I have with me? Is there anything specific?
Yes, that is another important aspect we need to cover. See, they need to have enough cash to pay their treatments. As I mentioned earlier, it will be communicated earlier. Second thing is they need to have their medical reports with them. Third thing, they need to be come in a medical visa. So before they apply, while applying visa itself, it has to be a medical visa, and they need to obtain a visa invitation letter from the hospital. We will facilitate all that. And they have to come with their regular medications if they are taking any regular medications, because sometimes the medicine is which is practicing here, it may not be available in Kerala or India. So till that we approach a doctor, or till the first consultation, we need to continue that medicine. So those medicines they have to bring, and they have to bring all the whatever the treatment they have done here, all the treatment records they need to carry. That's the most important thing.
Apart from Kerala being a medical tourism attraction, what are the other tourist destinations that people can visit?
See, people are coming to Kerala not only for treatment, because Kerala is it's more or less same like Sri Lanka. If you travel 100 kilometers, you will have a completely different experience. Like, we have backwaters, we have hill stations. So it's if you travel just 100 kilometers, that's a complete different experience. So people come to Kerala to enjoy those natural places as well. And apart from the tourism, we also have something like Ayurveda and wellness treatments. Like, you can learn yoga, you can take some Ayurveda treatments. So all these are added advantages. I think I'm sure Ayurveda is very popular in Sri Lanka as well.
Very true, yes. So after watching this video, maybe some Sri Lankans want to get their medical procedures done in Kerala with MCS Medical Tourism. So how can they contact you?
We have multiple channels open. They can simply send their WhatsApp messages, or they can visit our website and fill the patient inquiry form, or they can just email their medical reports. So they have multiple options. So depending upon the patient's convenience, they can approach us. Our approach is when we receive a query, within 4 to 6 hours, we will send them a letter saying that we have received the query and we need following information. So in that, we will ask for their previous medical reports, or we will have a questionnaire about what are the problems what they are facing, because sometimes people may not be able to explain it in a technical way, but still they will be able to express their problems. So we collect that, and we also give them the complete treatment plan based on their report. So that is the way how it works. That is the complete process. What we are when we are they are contacting us. This is the complete process. So they can contact us through WhatsApp. Our WhatsApp number is 952 665 3333, or just they can send an email to hello@mcsmvt.com. That's our common email ID. So they can send a query to that email ID as well, or they can visit our website mcsmvt.com. That is our website address. So in that there is a patient inquiry form. They can fill that as well.
So, when choosing a healthcare provider, there are certain precautions that a person should go for. What are those?
Like in India, we have in any part of the world, if you travel, there will be accreditation bodies. So they verify all the credentials of doctors. They verify all the legal requirements of that hospital, and they will ensure that everything is practiced ethically. So in India, we have something called as NABH. It's the apex body for healthcare providers. They are giving the accreditation. So in India, you can always look for NABH accreditation. It is the National Accreditation Board for Hospitals and Healthcare Providers. So based on their quality parameters, they will be giving the accreditation. So if you see that accreditation seal, you can confidently go there. That is the number one criteria what any person who is going to an unknown country or unknown place, that is the first criteria they have to look. And second criteria is whether they are traveling in a medical visa or not, because some of the places when they are getting into trouble when they are traveling as a tourist. So when they are coming in medical visa, it is they are very safe and there will be less legal complications. And Kerala is not only for treatment. We have something called as wellness journey as well. So if you can come there for just a regular health checkup, so like after 35 years, it is recommended to have a yearly health checkup. So you can come there for a health checkup. It's not a regular medical procedure. You just give your blood samples and necessary tests to be done, and you make sure that all your health parameters are okay. It's just like regularly we are doing the car service. No? Similarly, for us, we need to have that service, periodic service as well. So for that also, you can come to Kerala. And apart from that, post-corona, many people are interested in wellness treatments, learning yoga, having a healthy lifestyle and all. So that also you can learn from Kerala. Okay. So we have those kind of wellness retreat programs as well.
So can these procedures also be done at a very cost-effective manner?
Yes. Kerala is known for lesser healthcare cost without compromising on the quality of healthcare. So all these Ayurveda treatments, allopathic treatments, both you can do at a fraction of cost compared to other countries.
If you're somebody who's watching this video and you realize that you have a medical procedure that you can go ahead and get done in Kerala, definitely contact MCS Medical Tourism and start your medical journey.